Environment and health are so closely linked, but I think we've had a long time in appreciating that. As OBGYNs, we're experts in understanding that folic acid taken pre-pregnancy and early stages of pregnancy actually prevents spinal cord defects. We know that a woman who has diabetes and elevated blood sugar is more higher risk for having a fetus with cardiac defects. So we've seen this link for a very long time. We could look at mercury in Minamoto, Japan, and neurodevelopmental problems. So historically, we've known. It's just more recently we've seen some of the associations and understand now that we always need to look at the environment and women's health. FIGO's mission as a global voice for women's health is to really focus on women's health across the entire lifespan. And what I say, from adolescence through maturity. And we can look at the different stages of life. But FIGO then says, what do we need to do to optimize a woman's health care? Optimize how she receives the care and how she receives preventive health care across her lifespan. And certainly one of the areas that we focus on are those reproductive years, because we know in those reproductive times, a woman has to be concerned with not only her health, but if she conceives, how does her health and her nutritional status, her medical status, how does it impact the health of a fetus? So FIGO's goal is to improve the health of a woman across her entire lifespan and empower a woman so she's able to make very strong and important decisions about her life, about her reproductive choices, about her education, her work, her community value, and her family. You know, one of my areas of concern is something as simple and straightforward as prenatal vitamins. Some research came out of North America just a couple of years ago that showed, I believe it was like 30 out of 30 vitamin companies, when they were studied, the prenatal vitamins that we tell women to take before conception and during pregnancy were contaminated by lead, by arsenic, by cadmium, by a whole host of different chemicals that we would never want to be exposed to. So even when it comes to the regulation of something as important and as basic as a vitamin, it hasn't been adequately done. And FIGO's stepping forward in that area. FIGO is working to identify what should be just the no tolerance level in a vitamin. What chemicals should we just not even see? And make sure that that's the manufacturing standards. So FIGO has that voice in being able to say what's important for women, what we should expect and should not expect, and creating some standards around that. We can't build a healthier tomorrow without a healthier today. And when we invest in the health and well-being of women, we're investing in our future. Because we know right here and now, if we optimize a woman's health, if we reduce her environmental exposures, if we improve the care that she's receiving, it's not only an investment now, it's an investment in our futures. Because we know that when she conceives, if she is able to be healthier and carry that infant to term, have an infant who's born without birth defects and without problems, we're investing in tomorrow. And that really takes an investment in our environment. So whether it's the air we breathe, the food we eat, the products that we are exposed to, the water we drink, all of those exposures impact our health each and every day and impact our response to our futures. So we have to look at this as one planet. Climate change really is one of those very worrisome areas because it seems like it's out of our control. We're here and we're at the receiving end of so much that's going on. So whether it's the firestorms that we saw across Greece and Turkey last year, or for me, I'm in California, the firestorms across California or Australia, or whether it's the flooding that we see in Bangladesh or the Philippines. So much of that seems out of our control. So there's an element that we cannot do anything about except know that we have to respond to those vagaries. But we can advocate at our country level, we can advocate at our community level, and we can advocate even in our own OBGYN practices to make sure that we are making healthy, environmentally sound choices. So I think we've got to first understand that advocacy is critical. The second area I think we need to focus on is education. We need to be able to educate all of our colleagues about how serious climate change is on our health, and most certainly on the health of women, our patients. For example, the research is very clear about preterm birth and birth outcomes and the relationship between heat and particulate matter, that high levels of heat and particulate matter increase the risk of preterm birth. We also know that we have to be able to respond to those environmental vagaries by creating early response systems so that women are not put in a position where they're the last ones to be able to respond. I think one of the things that I'm often asked is, what can I do? You know, when we first came out with our FIGO opinion in 2015, our physicians and our patients all said, what can I do? If this is really about government regulation, then how do I have any control? And I think it's the little decisions that are truly impactful on our lives. So what I always tell women is make sure you know your food source. As much as you can, try to eat organic. You know, in Europe, we call it bio. In the United States, it's organic. But try and decrease your exposure to pesticides and eating healthy. The farm to table concept is really, really an important one. Knowing your food sources as much as you can. Going to a fresh market so you really know where you're getting your food is really critical. The next thing I would say is if you're going to heat in a microwave, and I use them all the time, don't put your goods in plastic. Put them in glass. Don't ever use plastic in a microwave. Just avoid it. One of my luxuries that I had to give up was my Teflon pans. When I realized what those chemicals were, I've switched to ceramics. You can switch to other sources of cooking and they're much healthier. So those are individual choices that we can make and make sure that we are healthier in all of those choices. And then advocate. We have to make sure that we don't have lead exposure in our pipes, that we don't have mercury in the food that we're eating when we're eating a lot of fresh fish, that we don't have mercury content. So know your sources of food, know your exposures, and make decisions like that.